We're back in beautiful Alicante, and today I'm going to show you UR Vistahermosa, a clinic based within a private hospital founded over 40 years ago. They're very experienced in reproductive medicine, so let's go see it.
Can you believe that I am looking at a fertility clinic and a hospital right now? I mean, the surroundings is just so beautiful. We are facing UR Vistahermosa. I want to show you how it looks, so let's see it first. So we're about to go inside. UR Vistahermosa is part of a bigger hospital, which isn't all that common. It's an interesting combination because it means that if you have any other procedures you want to get done while you're here, or if there are any consults that need to be done with endocrinologist or any other specialty, they're all in the same building. So
Let's go! Despite of being within a hospital, the entry to the clinic is a bit hidden, and there is a separate reception, separate waiting room, so that you can feel the privacy. At the reception you can check in, and then your coordinator will know that you have arrived. There are two separate waiting rooms so that you can have some privacy. On the same floor as the waiting rooms, there are the consultation rooms, so your medical consultation will be just nearby. UR Vistahermosa also produces educational materials, such as the leaflets you see here, and the magazine, both in English and Spanish.
So let's see what's downstairs.
Downstairs, you can have your consultation with a patient coordinator, and there are also offices, including where patient coordinators are. Majority of the patient coordinators are here on site, and they are in daily contact with patients or potential patients, guiding them through the process. Once you're assigned a patient coordinator, it's most likely going to be the person that will be there with you on site and will guide you through the process, all from the beginning till the very end. I had my first consultation with Claudia, who is a patient coordinator for the English, German, and Spanish speaking patients.
3 days of the week I'm at the office, so there I have to get in touch with my patients and to prepare things at the clinic. And 2 days I'm at the clinic. I love it. So here I can meet the patients. That's wonderful too. After so many phone calls, so nice to meet the patients in person. And here we are accompanying the patients during the treatment.
And look at this book published by their embryologist. It's so cute.
So now it's time to get my blood test done.
You can get all your testing done here at UR Vistahermosa.
Hola!
So blood test is also an option if you don't have a chance to do it in your hometown. It didn't hurt, their nurse was really gentle. So now that I had my blood test done, let's have my medical consultation.
My name is Laura, I'm a patient coordinator here in UR Vistahermosa. I'm glad to introduce you to Dr. Anaya, he's our medical director. He's going to explain how we perform treatments for international patients regarding logistics.
Okay, nice to be with you. So, well, normally in the first consultation, we speak with our patient, and there are two main possibilities. We can after the interview, we can send them all the tests they should do, and they can do them in their country, and then send to us the results. Or they can also come one day to the clinic and know us here, know the clinic, and we can perform all the tests during one morning. And then once we have the results, we normally study them and try to plan an individualized treatment for this patient. Then we send them the instructions. Of course, they will start the treatment in their country. They will do even the first scans, and then they will send us the results. And once they are ready for the final of the treatment, they will come here to perform it.
We try to make it as easy and comfortable for the patient as possible.
During my medical consultation, we talked about my case, hypothetically, and prepared for my ultrasound. So we walked through my test results, including my hormone levels, and we talked through all the possible options that are available for my specific case. The doctor was really kind and caring. I felt like I was being listened to. He does have that really good vibe. So for me, it was a really good match. Having Laura there, who was my assigned patient coordinator, was also really helpful. She was taking notes to make sure that I don't miss anything and that I don't have to memorize all the options, and she can then summarize them for me. After the consultation, it was time to have the ultrasound. The transvaginal ultrasound isn't the most pleasant thing in the world, but Dr. Francisco made it really nice by being gentle and kind during the procedure. I feel like I could kind of relax as much as is possible. He was really quick to notice my fibroid. It is always good to know where exactly those things are located if you do have any, as depending on their placement, they could affect your fertility. Now it's time to get back to our tour and see the lab. This is also the path you would be taking to the surgery room. So you would change here and then you would move to have your procedure. Of course, in case of egg collection, you would be brought in on a bed.
Hi, my name is Anna and I'm one of the embryologists at UR Vistahermosa Clinic, and today I will show you the lab. Come and see our facilities. Well, first of all, here we have the cryobiology room where we store all the samples from the sperm, eggs, and also the embryo of the patients. Not only the patient samples, but also the donors, because we have also our own egg bank and sperm bank, so that allows us to find the best choice for each patient, so it's the one that fits more. So then here we have the andrology room where we process all the samples for the procedure for ICSI. Also we do the semen analysis, and here we can also do MACs or microfluidics. Then we have the embryology room, that is the highest one. We have that stage that is for time-lapse incubator, well, conventional incubator and time-lapse incubator. We have 3 different ones, as you can see. And there we have 2 different microinjectors where we perform the ICSI and the cabin, where we do all the pickups for the embryos and for the eggs of the patient. So we do the pickup here, then we do this ICSI, and afterwards we incubate on time-lapse, and that's it.
So now let's see where the magic happens. So the surgery room. So here you would have your procedure, whether it's egg collection or the transfer, and the room is closely connected with the embryology lab, so eggs or the embryo can be moved to the surgery room very quickly.
Could you tell me a little bit more about EmbryoScope?
Yeah, we have the EmbryoScope. It's one time-lapse incubator that we use mainly every day. It's an add-on our clinic, but my advice is to use it every time in each patient, because for us, it's really important. You keep the embryos for 5 days incubating without disturbing the embryos. The conditions are maintained every day, and also we have like a video recording that we can check each moment of the embryo development to see which one is the best one and have a higher selection. So for me, it's much better to have the time-lapse than the incubator that we had to take the embryos out each time to check it.
Now let's see the recovery rooms. They're not on the same floor, so we have to take the elevator. They are quite cozy, very quiet, and with a nice view. Unlike other clinics, UR Vistahermosa has an option for overnight stay because it's a hospital, so majority of the clinics release you on the same day. You don't need to stay overnight, but if you needed to, it is an option here, which is very unlike other places. So now let's ask Claudia, what's something that she would like to tell you before coming to UR Vistahermosa?
We know that this process is very hard for you, emotionally very difficult. Don't worry about nothing. We are here for you. I'm here for you. from the first email until week 12 of pregnancy or until the birth of your child. We help you with everything. We help you with the booking of the hotel. We prepare the taxis for you. We are here for you at the clinic. You are not alone. I'm always here with you. I'm doing with you the transfer. I'm holding your hand during the whole process.
And going back to our tour, this is a place where your partner will leave their sperm sample. There is a light above the door to make sure that people know that it's occupied. And he can press this button once he's ready so that the embryologist knows when to collect the sample. And this is something very special about UR Vistahermosa. They also train future specialists in reproductive medicine through their university programs and hands-on lab training. So here you can see the graduates, and some of them actually stayed on and now work here as part of the team.
So I'm here with Marta, director of the International Department, and I would love to ask you, what would you say makes UR Vistahermosa different from different clinics?
Well, the advantage of UR Vistahermosa is that we are a small clinic, but we are within a large hospital. Mm-hmm. We belong to a group of clinics, which is the UR group, and all our clinics are within hospitals, which allows our patient to have personalized care and a more direct approach, but enjoying the benefits of a large hospital, because we can use the services of the hospital to help our patients. And I think that what makes us even more different is that after 40 years, we still maintain the main care around the patient. Each patient is different, each case is unique, and every patient needs a bit of attention from our team that may not be available for large teams in large hospitals. So we keep everything small so that we can keep everything intimate and everything special.
So you get one coordinator and they're with you for the whole journey?
Exactly. We always assign one coordinator to each patient. We try to have them physically present whenever the patient's available, and if we're on holiday, then we have a backup coordinator so that they will always be followed by the same group.
And is there a emergency team? So basically, if somebody has a question or an urgent matter in the middle of the night, do they have a person they can contact?
Well, not in the middle of the night, because fertility treatments are ambulatory treatments, and they usually don't have emergencies overnight. If you have an emergency overnight that you're bleeding, then you should go to your local doctor, because from afar we cannot assess that. But we do have contact available from 8 a.m. until 8 p.m. From Monday to Friday, and then we have over the weekend, both on Saturday and on Sunday, also a few hours where we check our emails, check our WhatsApps. We do have a WhatsApp communication system, so the patients have our contacts and they can reach out to us if they have questions.
And now it's time to leave and go home and think about my stay at UR Vistahermosa.
So I'm back after spending a day at UR Vistahermosa, so let's talk about it. The surroundings of the clinic were genuinely beautiful. I did not expect that. And the clinic being in the hospital, I was really expecting it to be overwhelming or overly clinical, which was not the case. And I was in a way expecting to walk in and see a bunch of ER patients waiting to be seen, but it was very welcoming, quiet. It did not feel crowded or anything like that. So you walk in, there is general receptions, and the clinic is hidden on the left side, and then you have the cafeteria on the right side. I do recommend the tuna salad at the cafeteria. It was really good, and you can grab a coffee there as well. So it is a nice addition, and it's just really close to the clinic itself. And because it is within the hospital, if you need any additional consultations, for example with endocrinologists, or if you want any other procedure done, it is easily available and you can kind of get multiple things out of the way while you're there. As for the consultation, it was very thorough. The doctor was gentle, welcoming, walked me through the process. I managed to learn quite a lot from it, and it was really nice to have the patient coordinator there with me. She was really, really lovely. Another thing that stands out is their own genetic lab, which isn't within the hospital, but it's nearby, and it means that PGTA and PGTM can be easily accessed and is not done by a third party. It also means that you can have PGTA done on a fresh cycle, which is not necessarily the case with every clinic. But even if you have it on a frozen cycle, the results will be with you much quicker because the genetic lab is UR Vistahermosa's. Everybody I met there was very professional, kind, empathetic. They really make it feel like you are within a separate entity. You're not within a hospital. It doesn't feel overly clinical, which was really nice. So who do I think UR Vistahermosa is a good match for? Definitely for people who are looking for a clinic with a strong medical background, easy access to genetic testing, and very professional but also empathetic team. They had a very thorough approach, which I really appreciate. And if you would like to be in a beautiful destination, that is also the case with UR Vistahermosa, because you will be in a sunny Alicante near the sea. So if you'd like to relax and stay on the beach or have a little holiday while you're there, it is a good option. More clinics are coming soon. Thank you so much for following me on this journey, and make sure to follow our social media channels. We are under Behind IVF Clinic Doors, so I'll see you soon.